The speech and language therapist role is in the assessment and management of speech, communication and swallowing problems. In this video, I'll go through how this relates to respiratory disease. I'm going to talk about the normal swallowing process, how respiratory disease can affect this, and tips for managing eating and drinking safely. I'm also going to touch on oral hygiene and tips for keeping your voice healthy. When we swallow, it involves a complex sequence of actions, starting with the anticipation of food. Your mouth starts to produce saliva at the smell of food and your appetite gets going. So once the food reaches your mouth, you close your lips around it to take it from the fork, and your jaw and tongue move to position things in between your teeth, and your cheeks work to stop things getting stuck down the sides or falling out. When you feel like you've chewed enough, your tongue then starts to move the food to the back of your mouth, and you keep breathing through your nose the whole time this is happening. When the food reaches a certain point at the back of your mouth, a swallow is triggered and your voice box, your Adam's apple here, which is the entrance to your airway in your lungs, comes up and closes off completely. And as it comes up, the muscles at the top of your esophagus open for the food to pass through your throat and down towards your stomach. As your voice box is closed during this action, you stop breathing for up to about 1.5 seconds, and your voice box then opens back up and you can start breathing again as the food travels down your esophagus and through towards your stomach. A respiratory disease can affect any of the stages of this process, especially at times of exacerbation, or if you feel unwell, you may be more likely to get out of breath from activities like cooking, preparing food, chopping things up, or even from the actions of chewing and swallowing. If you're eating whilst you're out of breath, that cycle of chewing, breathing and swallowing can be more difficult to sync up. During a meal, you're having to stop your breathing for at least once each mouthful, so this can really add up to make you more short of breath. Normally, after we swallow, we breathe out, but if you're short of breath, you're more likely to breathe in after a swallow, and this can mean that little bits of food particles or any leftover drink that's in your mouth have the potential to be breathed in. This is called aspiration, when food, drink or saliva or phlegm goes through your voice box and down towards your lungs. This could potentially cause an aspiration pneumonia, where material that's ended up in your lungs causes you to get an infection and be unwell. Signs of problems with swallowing could be coughing when you're eating and drinking, choking, getting very breathless during a meal or after a drink, feeling like things are getting stuck in your throat, or sounding gurgly and wet after you've had some food or drink. If you notice any of these things happening, then a referral to speech and language therapy for an assessment might be useful. Often, adapting the things that we eat and drink, especially at times of exacerbation or if you're feeling particularly tired, can be helpful to avoid the risk of aspiration and ensure you can stay hydrated and take in energy from food. This can include choosing foods that are softer and moist, requiring less effort to chew and cut up, avoiding dry, chewy or crumbly things, and eating little and often throughout the day to avoid being overfaced by a big meal. You might consider preparing your food earlier in the day and then reheating it later when you know you'll be more tired, or having a few meals in the freezer to avoid the effort of cooking if you are particularly short of breath on a certain day. Avoid using cups with spouts or straws, as this can make drinks more likely to shoot to the back of your mouth and cause you to cough. Have sips of a drink throughout the day and have a drink with a meal to avoid things becoming dry whilst you're eating. If you don't feel like eating much, consider choosing food that is really high in calories so you're not losing out if you're not managing a big meal. If you're concerned about your nutrition or weight, then a referral to the dietitian might be useful to discuss more specific advice. One difficulty you may come across is a very dry mouth, and that can mean food is more effortful to chew and push down. A dry mouth can be the result of a few different medications. It could be from using inhalers or being on oxygen, or some foods such as salt or alcohol or caffeine can all dry out your mouth and throat. There may be times when you feel like eating a meal is too much effort or not as enjoyable because of the amount of energy that it takes. This in itself could lead to missing meals, losing weight and missing out on the energy and nutrition from food that helps keep you healthy. Oral hygiene is very important, especially in respiratory disease. As you're more likely to experience a dry mouth, this means infections such as oral thrush can develop more easily. This is when germs build up in your mouth and can be very uncomfortable and require a prescription to treat. It's also thought that a build-up of germs in your mouth, if breathed in, could be worse for your lungs and cause a chest infection. It's very important to attend the dentist for regular checkups and to clean your teeth or dentures twice a day. Check when you've finished eating that there isn't any residue hanging around in your mouth or in your dentures, and know what's normal for you and keep an eye out for any changes such as pain, lumps or spots, and get them checked out straight away. Use a spacer for your inhaler if you have one, and rinse your mouth out after using your inhalers to wash away any residue. If you use mouthwash, consider using fizzy water instead, or choose a mouthwash that says it's alcohol free, as the ones with alcohol in can dry out your mouth even more. If you cough up any phlegm, rinse your mouth out afterwards to clear away any germs that it might leave behind, and make sure you change your toothbrush regularly, and especially if you've had a recent oral infection, to avoid spreading the germs back to your mouth. Consider buying an electric toothbrush, as this requires less effort and energy to clean your teeth compared to a manual brush. Many people with respiratory disease will notice a change to their voice. It can become more hoarse or difficult to get heard, especially with background noise. It can be more effort to speak, especially in long sentences, and speaking can make you more out of breath. Know what is normal for your voice and avoid doing anything that feels like you're straining. This might be speaking over loud background noise, or shouting across a far distance, or even asking a question to somebody upstairs or in another room. The voice works by air coming up from the lungs through your voice box and vibrating your vocal cords. Straining to speak can cause soreness and swelling in your voice box, which can cause your voice to sound hoarse and feel effortful to produce. Using inhalers can also dry out your throat, which can affect how your voice sounds. So again, always rinse your mouth out after you've used your inhaler to clear away any residue. To avoid straining, try to reduce any background noise, such as turning the TV off or radio down, and face the person you're speaking to during a conversation so you can hear and see what you're saying more easily. It's important to take sips of a drink throughout the day to stay hydrated. Coughing and clearing your throat can also cause some strain to your voice box. Fizzy water or pineapple juice can be good at loosening phlegm and avoiding dryness. Things such as smoking or drinking lots of caffeine or alcohol can also dry your throat out. You may also notice a dry or dusty environment, or as the weather gets colder and people have the heating on more often, can cause your throat to feel more dry. If you would like any more advice or information on the things covered in this video, or would like specific advice on swallowing or voice problems related to respiratory disease, please speak to somebody at Breathing Space or contact your GP about a referral to speech and language therapy.